Hello, I'm Dr. Natasha Patterson in the Department of Public Health, and I will be presenting on higher education's role in substance use disorder and recovery efforts. I conducted this project in the beginning. I started with a student in the public health program, Elizabeth Ferreira. She has since graduated, but her work lives on in this project. She did a lot of the groundwork in setting up and doing the background and significance research and also setting up with the speakers and things like that. So I wanted to make sure that I documented her work in this presentation. Just some background. The opioid crisis was something that we heard a lot about. There are statistics around adolescents, adults, prescription practices. The highest rates are among those who identify as white American Indian. However, the increase in opioid-related fatalities is larger in the Black and Latino communities, 63% and 43% respectively. There are disparities in physician prescribing behaviors, which may also influence these rates. There are also factors related to social and cultural norms. And then we also focused on recovery. So recovery is the process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. It is a critical time for community partnerships. Higher education institutions have the resources to address the needs of not only students, faculty, and staff, but the surrounding community. They are a part of the communities in which they are located. The Collegiate Recovery Program, those are programs that schools can implement that help students in recovery by providing recovery support services on campus. TCNJ CRP is run by Christopher Freeman and is a very valuable resource for students and allies. TCNJ's Department of Public Health, in partnership with the CRP, provides educational and awareness opportunities for students, faculty, staff, and community partners. The goal of this project is to raise awareness about the opioid crisis and substance use disorder, increase knowledge about treatment, recovery, risk, and prevention, improve attitudes, and reduce the stigma associated with addiction and recovery. Mobilize partnerships across TC&J departments and in the surrounding community to promote and protect health. Those partnerships include local policymakers, emergency management staff, law enforcement, hospitals, clinics, local social service agencies that provide services to recovery community, the Collegiate Recovery Program, recovery coalitions, and networks. So the events we've held so far included opioid symposiums, recovery conferences, racial justice, and recovery speaker series. The Racial Justice and Recovery Speaker Series is underway. We had our first one last Wednesday where we yielded about more than 80 attendees. The target audience for this event was students, higher education professionals at TC&J, and recovery staff. A previous conference yielded over 150 people, and that included professionals and peer recovery specialists, social workers, nurses, public health professionals, and students. And the opioid symposium, similarly, over 200 people in attendance and included emergency services professionals, law enforcement, social workers, nurses, public health professionals, policymakers, and students. And these are just the graphics that were used to promote the events. And some of the topics included some basics, just to provide some foundation, like who are the vulnerable populations, what are opioids, and what does addictive behavior look like, how to know when to call 911, statistics on overdose rates and trends, the impact of naloxone administration from police officers and EMS, stigma and recovery, recovery allyship and family support, social justice and recovery movement, racial justice and recovery, and the impact systemic racism has on drug policy and enforcement, and actionable steps to mitigate systems of oppression within the recovery community, peer professional development, and recovery messaging. Some of the outcomes: we conducted evaluations after the events. We will be doing one after the speaker series as well. But we found that there was positive outcomes. The reviews included the fact that people liked the idea of sharing their best practices with one another, being able to learn about how this work is being done in different areas, in different places, by different types of professionals. Increased knowledge and awareness overall, cross-disciplinary collaboration, shared resources, and student participation. Some funding opportunities. The last event last year was funded by Building Healthy Academic Communities grant. One of the organizations we partner with, they were funded by SAMHSA, Substance Abuse and Mental Health Services Administration. A previous event was funded by emergency management funding that came from an actual policy that provided funding to increase awareness in this area. And there are other grants available, including some from NIH, to do this work. Opportunities for students included being able to assist in conducting the research for the literature review and best practices, identifying and recruiting partners for the different events, assisting with planning meetings, assisting in the development of event scheduling, recruiting materials, topics and evaluations, organize volunteers, assist speakers with setup and organization. Students who worked on this, including Elizabeth, took the lead role on really developing and providing ideas for how this will lay out. She had a great relationship with our partners and was able to communicate with them and organize things. And she did a wonderful job organizing the volunteers for the event. Other students were involved in different ways. So some attended the event for more training and information. Others were able to network and identify potential internships and or job opportunities, and also identify mentors in their profession. These are my references. They include the CDC, the National League of Cities, and SAMHSA. And this is my contact information, my email address, patterson@tcnj.edu if you have any questions or comments. Thank you.